So hello, everybody, and welcome. I'm Susan Claffey. I'm the Director of Office of Graduate Services at ABPM, responsible for the clerkship and CASPER programs. And I'm excited tonight to have Dr. Michel with us. Dr. Michel graduated from the New York College of Podiatric Medicine and completed a residency at the VA in Denver, Colorado. She then, that wasn't enough for her. She then completed a fellowship in Podopediatrics and surgery at North General Hospital in New York City, and a diabetic foot and limb salvage fellowship at the University of Texas Health Science Center in San Antonio. She's board certified by both ABPM and ABFAS, and currently practices at the Fayetteville, North Carolina VA. She serves as the treasurer of the American College of Podiatric Medicine, is a member of the American Board of Podiatric Medicine Qualification in Training Subsection Examination and the Credentials Committee. She also serves as a liaison for the board on the Council of Podiatric Medical Education Residency Review Committee, the RRC, and she participates as a CPME on-site residency program visit evaluator, and is a member of the National Medical Association and fellow of the Royal College of Physicians and Surgeons of Glasgow. Tonight, she's going to talk to us about reaffirming CPME requirements for appropriate assessments. And as I mentioned before, we will take some questions at the end. If people want to stay and put questions either in chat or in Q&A, I'll keep an eye on both. And with that, I'm going to turn it over to you, Dr. Michel, and let you talk to us about assessments.
Great, thank you. And I will also provide my email address so you can email questions if you like. But thank you, Susan. Good evening, everyone. I'm Rosemay Michel, and it's my pleasure to discuss a topic that's just oh so exciting. Not really, but it is an important part of your program's functions and in terms of assessments. And all of you are aware of the requirement for assessments. So I'm just here just to reaffirm. And I hope by the end of our time together that I provide some pearls on how you can simply fulfill this requirement of the council. So the objectives of this talk are pretty much, I'll answer 3 questions. Why is it important to perform assessments? What should be included in those assessments? And when should assessments be performed? I'll have a brief mention regarding resident transfers. I understand there's some concerns and some questions regarding residents transferring from institution to institution. So I'll provide a little bit of information. I'll close out and provide some information on that. It's first important to understand how the council delineates assessments. And pretty much, and I know that, yeah, I hope you can see all of my slide, but I can't move my video. I'm not that skilled on Zoom, but the council defines assessments, separates assessments as either internal or external. Your internal assessments are those evaluations of residents that are conducted within the residency program by faculty, staff, peers, and patients. And for the purpose of validating how the residents acquire knowledge, skills, and their attitude, their cognitive assessment. External assessments, in comparison, are standardized evaluations or assessments. You can use the words interchangeably, but we switched over to assessments of residents that are monitored or delivered by organizations that are external to the residency program. And they serve to validate residents' experiences and development. A good example of these are the in-training exams that are offered by ABPM and ABFAS. The CPME standard that will be the focus of this presentation is standard 7.0, which states that the residency program shall conduct self-assessment and assessment of the residents based upon the competencies. And it's pretty much separated into 3 sections. 7.1, the 3 parts are first 7.1, which indicates that the program director shall review, evaluate, and verify resident logs on a monthly basis. Log review is a big topic and a little bit beyond this presentation. Program directors, you're all aware of your obligation to review logs for accuracy to ensure there are no signs of miscategorization or errors of miscategorization, fragmentation, or duplication. And because you know how much this can impact resident achievement of MAVs and diversity. But that is a topic for another time. But that is an important part of assessment. The second part of 7.0, 7.2, in which faculty and the program director are mandated to assess and validate on an ongoing basis the extent to which residents have achieved the competencies laid out for them. And finally, 7.3, in which which deals with the annual self-assessment. This part of the standard mandates that your program director, faculty, and the resident shall conduct an annual self-assessment of the program's resources and curriculum. So the assessment process is pretty tedious. It's first important to ensure the documents have the right elements and components, that it's sent out to the appropriate faculty that will best evaluate the residents. And then the hardest part, and we all know this is the hardest part, retrieving those completed assessments. And I understand there are a few coordinators on the call or on the conference, on this conference, and we are highly grateful for you because, of course, you make the jobs of the directors easier. And once you retrieve those completed assessments, then the work isn't over, because then the program director, you must review the assessments. You must meet with residents to have them review the assessments and sign off on them. And then you have to sign off on them. And it's a continuous process throughout the year. Which leads us to the first question. Why is it important to perform assessments? Although initially proposed in the 1920s, the ACGME and the American Board of Medical Specialties endorsed in 1999 the 6 core competencies that are used today and serves as the goal of our council. Those 6 domains include patient care, medical knowledge, interpersonal, interpersonal and communication skills, professionalism, practice-based learning and improvement. And the 6th domain is systems-based practice. And we know that that's also an important core strategy of our residency programs as well. And this is primarily, and everyone's on the same page, that this is the way we're going to educate and assess the next generation of physicians. And I think it's here to stay. There's some modifications and some changes in the future that are developing, but competency-based medical education is pretty much here to stay. There are a few advantages. Focuses on outcomes and the achievements of learners, residents, students, etc. It provides outlines of requirements for assessment that embrace the various teaching methods, formative and summative. It supports a flexible trajectory through the curriculum that's time independent. And finally, it increases accountability to stakeholders with a shared set of expectations, a common language for education, assessment, and regulation. Everyone's on the same page. Assessments are important, and there are 2 primary reasons why they're performed. First and foremost, to provide feedback that is effective to all parties involved and leading to curriculum development. In terms of feedback, this allows providing effective feedback that is timely, that is specific, that is actionable, and task-oriented, allows you to evaluate a learner's knowledge level and performance base. In In addition, not just the knowledge itself, but also skills, procedural and clinical, as well as to evaluate residents' professionalism, attitudes, communication. Those are all important aspects that residents and learners need feedback on. The second facet is evaluation of progress, to judge where judge where the learner is, how they're intaking information, how they are judging the information that they learn, as well as their decision-making ability. It also motivates learners and faculty. It motivates learners because they are able to determine where they should be and what they should learn. And faculty are, through assessments and through a very effective assessment process, can determine if their teaching methods are the best, and allows them to determine where the learners should be as well. Resource allocation is an excellent result of assessments. You, as the leader, as the program director, can determine how to allocate your resources differently, how to change the rotations, change the experiences, delete maybe what's not needed, modify others, add others. This is all a result of an effective assessment process. And finally, all of these elements work well to allow you to change and develop your curriculum. Most ideal would be a 360-degree program feedback, which is not required by the council. However, it is a well-rounded, thorough evaluation of all aspects of a program, in this case, residency program, that allows measurement of the strengths, weaknesses, skills of all involved parties. Essentially, it's a well-rounded performance review of the program. And if it's well-designed and it's performed well, it can boost team performance, it can promote self-awareness, and create transparent communication. And when such a process is utilized, essentially all involved parties evaluate each other, all aspects of the program. For example, the resident is evaluated by all faculty, program director, other residents, ancillary staff, peers, patients, even administration, even students. Can't forget that feedback of students might be helpful here, as well as a program director and vice versa. And so you can kind of understand, you kind of get the feeling for what a 360 program feedback is, that all the elements will be involved in the assessment of all other elements. However, again, a 360-degree feedback is not required by the council. So what should be involved in the assessments? It kind of leads us to the second question. What should be included? What should you be doing as program directors? Going back to the standard, the faculty assessment of residents is specifically when residents are on rotation, their rotation experiences. So it's important to include competencies that are specific to the rotation. You want to make sure that the resident can attain those competencies, testing their knowledge level, ensuring that they obtain the skills that they're supposed to get as a result of the experience. And of course, attitude and professionalism is always important. The cognitive assessment is always important. All rotation assessments forms must identify, and even as a header, because oftentimes we find that blank assessment forms or assessment forms during on-sites are not complete. You want to make sure that every form is uniform, has the dates of the rotation for the resident, has the name of the resident, as well as the evaluating faculty. As a footer or the like, you should have signature boxes for the evaluator, the faculty member, the resident, as well as the program director, where they can sign and date. It's very important to time the timing of these assessments. Once the rotation is completed, and I'll talk about timing in a future slide, but once the rotation is completed, it's important to to obtain the assessment fairly quickly, so that when the evaluator's memory is still fresh. And so it should be there should be a quick turnaround. Our coordinators help us with the turnaround of the assessments. However, not only obtaining these assessments from the evaluator, but also having the resident review them in a timely fashion is important. And it's important to have these assessments for every rotation, every experience that the resident has, and ensuring that the evaluator that the resident works with the most is the person who is evaluating them. Finally, just a word on electronic assessments, as many programs are now transitioning to the electronic process. Many of them are customizable. There's a variety. There's quite a few programs out there that electronic programs that many programs are currently using. You want to make sure you customize it and add the signature lines that you need. So, and not even signature lines, that they're able to digitally sign both the resident as well as the program director. That can be an issue sometime with on-sites if we don't see that information. The next type of assessment is a program director assessment of the resident, which is the semi-annual resident assessment. And this is when the program director sits down with the resident and evaluates their knowledge level again, as well as their skills and their attitude, and wants to ensure that the resident is achieving the competencies as they should. So ensuring that residents are completing the rotations, ensuring that the rotation assessments are also completed and in the file and signed by both the resident and the program director is important. This is a perfect time for the program director to have a one-on-one discussion with residents regarding their logging activity. Many programs run into issues with logging. They might have ample resources and lots of availability of different experiences, but documentation of the experiences is lacking or missing. And so when you sit down with your residents during the semi-annual assessment, you want to make sure that they are logging all experiences, whether it's podiatric or non-podiatric, medical and or surgical, and that every month is accounted for. And this also will ensure that residents will meet their MAVs, which is the next section of the semi-annual that should be included. And I do recommend that on your semi-annual cheat sheet or blank sheet, that you have a space where you discuss log review and you discuss their MAVs and go through the diversities as you check their logs. So you won't run into trouble with possibly, God forbid, graduating a resident who's short MAVs and something that they should have attained. So all of that is are components of your semi-annual assessment. Keep in mind that as a director, you can include any information that will help the resident grow. And so feedback from ancillary staff, patients, peers, because you already have the information from rotation, from faculty rotation, can also be included in this session. Just a word on in-training exams. You all know that the council does require that residents participate in taking in-training exams. So the program, in the 320 document, it states that the program should require that the resident take in-training exams as prescribed by JCRSB recognized specialty boards, of which are ABPM and ABFAS. The sponsoring institution must pay any associated fees. Just a word regarding in-training exams, that they're an excellent way to assess how your program is doing in terms of meeting competencies and preparing the patient for board certification. And actually, both ABPM and ABFAS allow graduating residents to use the ITE towards qualification. So you are definitely providing a great service if you encourage residents to participate and take both. And residents are truly, they're eligible for both because they are completing a 3-year program. So that's to be something that should be strongly encouraged. But again, the results of these examinations should be used as a guide for resident remediation, curriculum development, and as part of the program annual self-assessment. Which takes us to the monster that is the annual self-assessment. Everyone's favorite report to put together, I'm sure. 7.3, the annual program self-assessment, is if you simplify it and develop a standardized way of developing it, then it should definitely be easier to put together. According to the council, and prior to the pandemic, this is expected to be a formal meeting of the program director, faculty, residents, and meeting face-to-face in the past. But of course, now it's important to just meet your needs, whether you do it virtually, you do face-to-face on a smaller scale, or even electronic feedback from faculty, from rotation faculty. But all of those elements must be included in the assessment. It is a review of the program's resources and curriculum. The main goal is to provide information to allow you to improve your program. And components include, number one, identification of participants. As I stated before, in whatever format they provide feedback, you should include this on your report. Performance data, these last three I'll discuss in the upcoming slides, but you should include performance data of your program, measures of program outcomes, and finally, the results of your review. Performance data, and again, this is all things that you can add. You just have to make sure you have parts of each in your report. But your performance data is information that confirms that the program is compliant with the standards of the council in terms of competencies, in terms of the evaluation of the program by the residents. In addition, the program director's evaluation of faculty. You can include this information in this section. And finally, the didactics. You can't forget that the didactics should complement and supplement the curriculum. This is a good place to include this information. The second section, measures of program outcomes, is where you can flaunt and show off and let us know how your program is achieving and the success of your program, how your residents are achieving their goals, and how they may have performed on in-training exams, their success in obtaining board certification, their state licenses, as well as if they are in private practice or in hospital staff or academic medicine. This is a great place to collect this information, which means it has to be collected. So you have to kind of send a form back to your residents, to your graduates, and kind of find out where they are, where they're, how they're doing and how they're progressing. This is also a great place if there's publications that are out of your institution, out of your program. This is a great place to include this as well. The final section of the program self-assessment is the section entitled Results of Review. And this is all about the competencies. So you are determining whether the program curriculum is relevant to the competencies, the extent to which the competencies are being achieved, and whether they're being met or not, but achieved. How all involved parties, from the residents to the program director to the program faculty, how they understand the competencies. And finally, if resources need to be modified, enhanced, allocated to ensure those competencies are being achieved. This section, so you can kind of kill two birds with one stone, I guess I shouldn't say that, take care of two tasks at one time. This could also, this process could help you fulfill Standard 6.0, in which you are mandated to collaborate with rotation faculty to modify any competencies of each rotation experience. So you can certainly, this is sort of an overlap. You can use the information you get from your interviews with the rotation faculty and include it in your results or your review, or vice versa, since this comes first because it's in June versus the beginning of the year. So you're not doing the two tasks at two different times. This is an example on the website of an annual program self-assessment. So it may look familiar to some of you. You might have used some of this, if not the entire format. But again, this is just a sample. This is just some recommendations. This particular sample starts with an evaluation of the program's compliance with CPME standards. The only thing I would recommend on the top of this report is that you include information regarding those participants who participated, the participants of the review, those who provided feedback, so you could compile this information. That's the only thing this report is missing. However, you can see that the first item that is reviewed on this sample is evaluation of the program's compliance with standards. Then the next topic was the resident selection committee and a table with information regarding the applicants, their average GPA, range of GPA, number of applicants, the schools that they attended, the students. Then the numbers the statistics regarding was selected. The third item is when you get into the performance data information, the residents' formal evaluation of the program and the faculty, as well as program director's assessment. Number 4, assessment of the curriculum to determine its relevance to the competencies. Number 5 deals with the resources in terms of what needs to be modified. Then you have the didactic activity evaluation, the measures of outcomes in terms of resident performance on in-training exams. Now to the next page, the attainment of board certification and licensure and what the graduated residents are doing. And then the following, I believe, including this 5 pages, is pretty much a checklist comparing your program. The right column, I don't know if you can see it, has your program, what your program has in place compared to what the CPME standard is. And in the middle column is is whether or not it's been met. Again, just a recommendation, but it will certainly help you go through. This is basically going through the CPME 320 document to ensure all elements are in place. And that was the last page. Okay, so when should assessments be performed? And I mentioned them briefly as I went through all of them, but just as a recap, the rotation assessment should be performed once the rotation is completed. Again, it's important to consider timely review by the resident and the program director. So if any changes have to be made, they can be done. Your semi-annual resident review, again, is semi-annual, so that's typically every 6 months. There are some programs that do this a little bit more often, quarterly. It allows them to kind of rein in the residents and ensure that they are meeting all their requirements timely, and also really just gives you some checks and balances to make sure they're logging and achieving their MAVs. In-training exams vary from program to program. Some will have the residents take up both exams each year. Some will divide it up based on whatever the program director's desire is. This council does not have any specific requirement of when you administer or you have the residents sit for in-training exams, just that you do. And finally, the program self-assessment is annual. So that's usually performed at the end of the academic year in June. So that is it on the piece regarding assessments. I'm going to move on to resident transfers. I know there were some questions regarding transfers as a whole. Everything that I am going to tell you is are in the CPME documents, but also I have some updated information from council staff that I'll also present to you. When a resident transfers from one facility to another, documentation is required, I should say, from both the releasing program and the accepting program. From the releasing program, the council mandates that they receive written notification within 2 weeks of the resident's departure from the program. The program director releasing the resident should submit to the program director accepting the resident a copy of the termination release letter, the training schedule that the resident was following at their facility, signed assessments validating the resident's progress, and then signed resident logs from the resident's start date to the date of release and termination. So everything that has to do with the resident, the accepting program should receive. The accepting program is also has documentation that they must submit to the council. They need to submit it within 30 days of the resident's official acceptance into the accepting program. Of course, there is an application fee, and that up to date is in the fee policies. The accepting program director should provide the name of the releasing institution, the category of the residency program that the resident participated in, as well as the dates. Must provide confirmation that the resident is transferring into an open position and the year in which the resident is accepted. Confirmation that all required materials have been submitted by the releasing institution. And they must also provide a new comprehensive schedule for the time that the resident has remaining in the new program. After the council staff receives all the information, it's forwarded to the RRC chair for consideration. If approved, the new program or the institution receiving the resident is approved to grant a certificate upon completion, a graduation certificate. If not approved, the resident may not receive a certificate, and the program may find itself on probation or administrative probation. So it's really important to follow these policies and these rules. Finally, if acceptance of a transfer constitutes an increase in position, the sponsoring institution must apply for authorization of the increase. So these are all principles that must be followed, that protocol. Just some information kind of hot off the press from council staff. The information will be filtered to you sometime this month. I think it's important to actually just acknowledge that this is in reference to two categories of residents: current residents repeating the PGY1 year, and residents with existing PMSR, RRA certificates who wish to re-enter residency programs. For residents who have completed 1 or more years of training and wish to restart training in a different program as a first-year resident, they are not considered resident transfers. So therefore, the rotations they've completed, the logs that they've completed, the MAVs they've met will not transfer. They have to start all over. So current residents repeating the PGY1 year start as PGY1 residents from the first month on for, of course, the 3 years. They are not transfers. As for residents with existing PMSR RRA certificates re-entering residency programs, if a resident, and there are some that exist, if a resident possesses such a certificate and wishes to receive a second certificate for any reason at all, they must begin as a first-year resident, and they must complete all 3 years of training. So this is new information that will be provided to you by the council shortly, I believe this month. So in conclusion, besides giving you some information on the protocol for resident transfers and an update in terms of the policy, I have given you information on assessments, why we perform them, what should be included in assessments, and when they should be performed.